Hey everyone, MedMade Easy here. Today we have a special video for you, the NCLEX study tips series, which we'll be doing more of. We will have some questions today that we'll go over, some different study tips that you can use. These are just some ideas, and the topic today is pediatrics. So let's go ahead and get right into the tips. And like I said, make sure to hit the subscribe button, the thumbs up, and also the notification bell. When you give us a thumbs up, it lets us know that you like this kind of video, and we will make more of these kind of videos. Let's go ahead and get on to the first. Pyloric stenosis. Pyloric stenosis often will have an olive-shaped mass in the upper abdomen of the child. And also seen with pyloric stenosis is projectile vomiting. This diagnosis is typically seen during weeks 2 to 8 of infancy, but can be seen under 6 months. This can lead to electrolyte imbalances and dehydration. So one of the things that you want to do as a nurse is to make sure to check for sunken-in fontanelles and also if the patient is lethargic. These may indicate dehydration. Autosomal recessive disorders. Know that an autosomal recessive disorder can be passed from parent to child. The disease will result if both parents pass the trait to the child. On exams, you might get a list of different diagnoses and asked which one is autosomal recessive. Cystic fibrosis. A child who has cystic fibrosis typically needs high protein and high calorie diet. They also lose a lot of sodium in their sweat. Salty snacks are a great idea to have on hand. Tetralogy of Fallot. Children with tetralogy of Fallot can have tet spells. These spells cause the child to turn blue after or during crying, feeding, and getting agitated. This is due to a rapid drop of oxygen in the blood. Retinoblastoma. A lazy eye pain, headaches, absent red reflex, and or whiteness in the pupil, leukocoria, are all signs and symptoms of retinoblastoma. Retinoblastoma is a form of cancer that can develop rapidly. It is almost exclusively found in young children, typically before the age of 5. Fontanelles. The anterior fontanelle normally closes between 12 and 18 months. Any delay in closure after this is considered abnormal and needs further evaluation. Reye syndrome. Children under 18 years old should not be given aspirin. If given aspirin, they are at increased risk to develop Reye syndrome. Our final info study tip for today is about child abuse. Child abuse should be suspected if there are unexplained bruises, fractures, burns, bald spots on the scalp, a withdrawn child, and or fear of the parent. Thank you guys so much for watching. This concludes today's video. Stay tuned for more NCLEX info tip videos like these with different topics. And make sure to subscribe to our channel for all sorts of nursing type info, career tips, study tips, nurse practitioner tips, nursing student tips, all sorts of tips. And if you're just wanting to learn in general, this is a great channel for you. Alright guys, until next time. And also make sure to hit the notification bell so you can get the latest videos.